Plus, we pay 2 times your tax.
I just can't believe this is happening, to tell you the truth. It's really something. But we're going to begin with Robin at the Vatican. She's there for an historic conference on stem cell therapy. It could provide hope for millions battling rare diseases. And Robin, you're about to introduce us to a very inspiring little girl.
I really am, George. This is the first day of the conference, and the theme is Hope for Our Children. A research center in Sioux Falls, South Dakota has given hope to many children with its work in adult stem cell therapy, and you are about to meet one of them.
It's Olivia.
It does. How old are you going to be?
4.
Good girl.
She was precocious. She was adventurous. She was amazing.
On her 4th birthday, Olivia was a typical preschooler.
Hurry before the alarm goes.
She wanted to be involved with everything, sports.
Very active. Good job, Lily. Look at me.
But soon, Olivia's parents noticed their lively little girl was changing. When did you realize that something wasn't right?
Really, it was when she was 7 that we had the rapid decline in the vision, and we said, this doesn't seem right at all.
For 2 years, Olivia and her family met with doctors all over the country, searching for answers. Finally, at age 7, she was diagnosed with juvenile Batten disease. It's a rare genetic illness that commonly affects children, destroying brain cells and causing neurological disorders, including blindness, frequent seizures, dementia, and ultimately premature death. How did this time impact the family?
Everything's different. Nothing is anywhere near what it used to be. It affects everything.
You know, think about your child if you have a normal, vivacious, outgoing 7-year-old daughter who suddenly goes blind, and then imagine that's just the beginning.
Batten disease is just one of 7,000 rare illnesses affecting 30 million Americans. More than half of the people impacted are children.
Game is a game.
It's a game, yeah. Do you like to play games?
Uh-huh.
Now, 12 years old, Olivia's illness doesn't stop her from being the jokester in the family, keeping her big sister, Sydney, smiling. What is it that you're hoping with this new technology that maybe you'll find something to help your sister?
Yeah, I'm really hoping we can find a cure soon so we can save her.
Sioux Falls, South Dakota is home to one of the country's leading medical systems, Sanford Health. The castle-themed children's hospital draws people from all over the country. And children like Olivia, battling a rare disease, have found hope in the cutting-edge work that happens here at Sanford Research Center. Shall we?
Exactly, this way.
I caught up with Dr. David Pierce to get a glimpse of the work that could potentially save lives through adult stem cell therapy. This is extremely impressive. Tell us a little bit about this facility.
You know, what we're working on here is cures for rare diseases, cures for children. And you met a child with Batten disease earlier. Unfortunately, cells in her brain are dying. We can try and compensate for that with drugs and with gene therapy. But ultimately, we want to be able to replace those cells and restore her to full function.
Less than 1% of rare genetic diseases have FDA-approved treatments. It's a race against time to implement the ultimate cure, adult stem cell therapy, which is still in the research phase. Dr. Pierce, how close are you to FDA approval?
For gene therapy, we have FDA approval now. For stem cells, it's going to be a slightly slower process because it just hasn't been done before. You know, I'd like to be optimistic that 1 year, but it's probably more realistically 3 years, quite frankly.
When I see the families that I've met, they know what you're doing here, and it gives them hope. How excited are you where you are right now, this facility, and how close you are to making some breakthroughs?
The fact now that we actually have clinical trials in progress, treatments in progress, I personally can't think of any more job satisfaction than that, because it's not a job, it's a passion for life.
It is. I will never forget spending time with Olivia and her family, and also Dr. Pierce and all the researchers there. And this woman was with me in Sioux Falls, Dr. Robin Smith, president and founder of the STEM for Life Foundation. This is the third year that STEM for Life and the Vatican have joined forces for this conference. And every time I say that, people always still like, what? What's going on here? Tell us a little bit about the conference.
Well, it's really exciting. We have politicians and scientists and patients from all around the world, regulatory bodies, really focusing on how we get these cell therapies developed and to patients who are in need.
And a global initiative as well.
It's a global initiative around a very simple concept that the cures for tomorrow are going to come from cells within our bodies today.
And we need to talk more about that, and that's what the purpose of this conference is for, because many people who have gone through illnesses, my colleague Amy and myself, we went through it so many, the number goes on and on and on, but we had to use drugs. That was the first line of defense. But you and others, researchers, scientists are saying, there may be another route to go. Explain that.
It's a way to get your own body's immune system to be harnessed towards whatever the disease you're trying to fix. So maybe it's to make a vaccine for cancer, getting your own immune system to kill those cancer cells, or to stop an overactive immune system from killing the good tissues. So we're learning more each day.
Immunotherapy, and I know that we talked about that today, and we'll continue that. So Vice President Biden tomorrow.
Yes.
He's going to talk about his moonshot initiative.
Yes, and a little about his personal story and what has, really made him focus on this.
And then an audience with the Pope. How did that joint venture come together, Robin?
I think we all want the same thing, how to help people who are suffering, sick, and are marginalized. It's the year of mercy, and everyone is just excited for this global movement to see what we all can do to help people.
And again, it is a global movement. And for people who are wondering at home, we're talking about adult stem cell therapy, not embryonic
That's right.
cells.
There's 5,000 clinical trials focused on taking adult stem cells and using them to repair damaged tissue, which is regenerative medicine.
And everyone that I've been talking to here, my doctor, Sergio Giralt, is here, my sister, researchers, Dr. Pierce, who you just met in that piece, he's going to be receiving an award later. Sanford has just done wonderful things there in Sioux Falls. And when you talk about it, people are really feeling that we are on the brink of really major breakthroughs, major differences.
Absolutely. Effective therapies and maybe even cures. It's not that far away.
You did say the C word, cures.
I did. We're all really focused on that, and I think that's the difference of using the drugs you talked about, right? And it's very different to restore and to use your own body's immune system. It's much easier to tolerate.
Thank you so much
Thank you
for the tireless efforts of your work
and
this conference.
Here.
Oh, absolutely.
We are so appreciative.
Yeah, they're having all these weddings back in New York. I feel like I'm missing something there. George?
Looks like we're missing something too, Robert. Thanks for sharing it with us. And now let's go outside and ginger.